and waiting for the recording to start. Got it. Call to order this meeting of the Dunn County Health and Human Services Board for February 23rd. Let the record show that Supervisor Morehouse, Supervisor Breslin, Supervisor Hagan, Supervisor Steen are present. Dr. Hall and Ms. Barker also present. We have a quorum. We have meeting minutes from January 26, 2023. I would like a motion to approve. Supervisor Steen, is there a second? Dr. Hall seconds. Any additions or corrections to the minutes? Any additions or corrections? If not, all in favor say aye.
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 Any opposed? The minutes from January 26th are approved. And we have public comment. Miranda, is there anything that you would like to add here as a member of the public joining us tonight?
Not at this very moment.
All right. Well, thank you very much for listening in, and we'll be happy to respond to questions if you have some. The next meeting date, the next regular meeting date is the 23rd of March. Is that a problem for anyone? If not, we'll go forward with that. That's our regular Thursday meeting. Do we have Greg Quinn with us?
I am present. Can you hear me?
There he is. Hi, Greg. You are up with a staff report.
Okay, I will, with the documents that were sent out, I'm going to start with the monthly report, the items of interest. I'll cover the carry forward when we get to the action items.
Sure, that's fine.
Okay. So probably the most significant thing to report again, and I'll keep giving updates as things continue to unfold, but the legislation that was passed August of 2022, termed the PACT Act, things we're seeing quite an uptick, and mainly regarding hypertension claims is what I would highlight the most, which I believe is going to, for the time being, for the next 2 to 3 years, is probably going to be the most significant claim, and that's in relation to our veterans that were exposed to Agent Orange in Vietnam, as well as Thailand, as well as Guam. So things are in full swing, and we're seeing some of those outcomes already coming back. So that's extremely positive. On the state level, as part of our Wisconsin Association's leadership team as the second vice president, and so we are working on collaborating with the National County Veteran Service Officer Association to conduct our annual training, which is this year. The state of Wisconsin is hosting it in Madison. I think the number that I've heard is roughly about 500 individuals will be coming in for the training of that, and our planning role is honestly pretty minimal to just kind of state that, but part of it is just to ensure that we're providing some of that welcome piece, and it's down in Madison, so I mean Madison opens their arms to things like this, so that'll I think will go well. There's a meeting that's scheduled with the newly appointed Secretary of the Wisconsin Department of Veterans Affairs, Mary Cole.
James Bond, I love it.
Yeah,
I just loved it.
He's been with the state government for I think probably over 20 years, and so he's going to be taking over for Mary Kohler, who had retired.
I can't imagine growing up with that name. I'm sorry. Shaken, not stirred. I mean, just.
Well, He's a Marine, so I'm sure that he can handle it.
Good. And don't tell him that we were amused.
I'm sure he's heard it plenty times. So there's actually a meeting. I don't have that on here, but I won't be attending, but our state association's president is going to be meeting with Mr. Mon, kind of talk about what we see as association leadership as important going forward. And the primary thing is just that relationship, like everything gets done when you have a strong relationship. And so we definitely anticipate continuing with that, and things have been pretty strong and supportive for the past probably 10 years. On the federal side of things, I've talked a little bit just with kind of the local part in relation to the PACT Act. And so I think that in our process with veterans, everything's really is driven by the educational piece, explaining the process, the procedure, and the expectation. And so probably the last 4 months has been trying to be better about setting expectations for individuals, what they should expect from myself and staff in the office, as well as the expectation regarding the submitted evidence to the expected outcomes. And I think that's kind of bore some fruit, and because I think it helps when you know on the front and you have some of those expectations, because as an employee of the county, those that live in the community should kind of know what they should expect when they come into our office, and so that they can hold us accountable, and to know that absolutely what they heard we were supposed to do actually is what gets done. I'm going to go back to the local part, and I credit Chris with connecting our office with Mr. Mel, who is going to assist with helping market the PACT Act. We had a meeting earlier this week, and I believe he's a consultant to help kind of get some of our highlights as a county out there. So he's already drafted up something to help get out into the media. I just haven't reviewed it yet. So that I think that's going to go well. And he did a good job kind of extracting information from us on what do we want the community to know about this newest legislation. And ultimately, what we want to know is for people to call us or stop in. And so we'll hopefully that'll get put out into the media here in the coming weeks.
Excuse me, Greg, Supervisor Hagan has a question, I believe.
Okay,
Hey, Greg, can you hear me?
I can. Yes.
Okay, great. I just had a question going through the federal benefits, and the local summary says that there's been delays in claims as a whole. Are you saying that for the claims procedure that people who are there claims that are not related to the PACT Act, are those getting delayed in addition with the PACT Act claims? Is that what that's saying?
Yeah. As a whole, the best way I can describe it is that there's inconsistencies in the claims process. There are numerous things that can slow up a claim, and sometimes even if you have just the perfect evidence, it still may not move smoothly. But there's also the other side that it can go through great. It's inconsistent, but we're seeing some delays, and honestly, those delays are still not anywhere near what we saw like 10 years ago or 11 years ago. So it's not bad. It's just different than what we have been seeing the last 2 to 3 years. And I would credit that to the uptick in the number of claims going through the VA, trying to onboard additional staff to help to be at the right staffing level to handle this new legislation.
Supervisor Steen has a question, I believe, Greg.
Greg, you partially answered it. My question was going to be, Do you think the slowness is a result of staff turnover or hiring new staff that has to learn the ropes?
I think it's hiring new staff. And honestly, the quality of the work, it's multi-factor. I'll never put anything on any one entity that it's their issue. As service officers and people putting forth claims, we have a responsibility to put forward a good claim. And so if we have people throughout the country that aren't putting forward or putting their best foot forward and put the right effort into a claim, that bogs the system down because it's going to get denied and increase appeals. One other contributing factor is the VA in their improvement process. They want things to be more electronic. Our end as service officers, not a problem because we have access to the systems, access to the training and what's necessary. However, they're trying to push out individuals to do their own claims through an electronic program called e-benefits. It serves a good purpose, but what it doesn't do is it does not train an individual that is putting in a claim themselves on all of the necessary items that it takes to get it approved. And so that can result in it being denied, and then they'll get involved with the service officer to try to help through that. So I think that is also contributing to some of these delays.
Supervisor Steen?
Yes, Greg, you can pass this up the chain of command from me. That's a short-sighted approach to ask our veterans to become skillful using the mode of communications that younger folks master easily. So I think this is an abdication of what they should be doing. Thank you.
Thanks for that.
Yeah, absolutely share that. And our association feels the same way. There's a purpose for that use of that technology. But we ultimately want individuals to come to our offices. So if at a minimum, we can advise and assist and kind of counsel them on how to get things done properly. I'll jump to this staffing. We're pretty excited. Thanks to some good effort from our HR team. We're going to be onboarding next week our part-time position, which County Board had approved an 8-hour position for our office. And so we're kind of excited to get that person on next week. And she's been an intern in the past and officially accepted the position today. And her name's Nikki Massbergen. And she's a spouse of a veteran. So she's helped as an intern in the office. So this should be pretty seamless, but we've got some specific tasks that she'll be taken on, and it'll help definitely with the outreach that we're trying to conduct as well. If there's no questions, I'll move to the budget. And the first part of the budget discussion is my confessional, and that is we did not spend any money in January according to what you received. That is incorrect. That is a result of me not hitting the update button on the new budget format. But I do have, and I'll just kind of brief this by exception, what we did spend. And so I can tell you that in our salary and fringe for the month of at the closeout of January, we spent $18,642. And then under our operating expenses, we spent $155. And as I looked then into our Veterans Relief Fund, we ended up, it looks like we spent $306, and then I think $99 in our grant, because we have three cost centers. So I apologize for not sending the correct numbers, because that gives you a wrong picture of that we actually do spend money. There's a cost to it. But early in the year with one month under our belt. We don't anticipate any issues or concerns going forward. And with the new position coming on at 8 hours a week, 52 weeks, it's about 416 hours. And that isn't going to be a structured 8 hours a week. So there'll be, we'll definitely be able to get all those hours in for our new hires starting next week. So apologize on the report you guys got.
Quite all right.
By exception on this. So is there any specific questions you'd have in relation to Veterans Office budget? All right, then what I will do then is I will move to the Veterans Served report. And so the veteran served report. Look here, I just have to hold mine up. I can't read my screen sideways. So as I look at kind of draw your attention to the retroactive money that shows a little over $30,000. And with that, that's try to emphasize each month, that's real money that goes into a veteran's pocket that month that I'm quite certain gets spent rapidly within our community. And so we've started, and it kind of minimal highlights as far as the impact. And again, it's in relation to PACT. You're going to hear me talk a lot about that new legislation. I'll give credit to the VA that they have started to send out letters to alert veterans, and that's we're trying to do our piece locally, and hopefully we'll get something out in the paper the next week or two to alert those in the community that there may be some benefits that they're entitled to. But also the VA is trying to do their due diligence as well to reach out to veterans that have filed claims in the past or surviving spouses. And a lot of that's going to be driven by updated addresses. So if they don't have an updated address, there could be some folks that may not get their benefits or know enough to pursue them. Is there any questions for me to close out the report?
No, but it's pretty impressive work for the year, both in terms of the numbers of services provided and the amount of dollars that flow based on your hard work. So thank you, and Jessica, very much.
Thank you.
And I do have a question for you, Greg, that isn't in your report. It's my understanding, although perhaps not, excuse me, fully formed, that the governor has a proposal for additional funding for veteran services offices in the proposed budget. Do you know anything about that?
Yeah, we've got a couple of things that are in the works. There's and I'd have to look specifically because it's a little confusing to me. But the one thing I can state factually is that there is a supplemental service officer grant that Chris has already signed, that we've sent in, just awaiting to find out if we should be approved. By all accounts, it will be approved. It's remaining ARPA money, the COVID money that they're going to distribute, and we're looking at I think it's like $15,800 that we may receive through fiscal year 2024, the calendar year. But as far as any additional, I have read, I can't confirm, but I have read that it appears that they might be doubling the service officer
But it
grant
sounded like.
specifically, yeah, which is 11,000 for us. That might bump it to 22, but I have to read a little bit more about that. I can speak directly regarding the supplemental claim that looks very promising, but you guys will be aware of that once we get it, because we'll need to do a budget adjustment.
Yeah, thank you for that. Any further questions or comments for Greg from any of the board members? All right, if not, we'll move on. And I just want to say, Supervisor Breslin, I don't obviously have a picture of you, so if you have a question or a comment, just shout. How about that? And I'm going to turn this now over to Katie Gallagher for the Public Health Department report.
Good evening, everyone. So in the packet that was sent out, you will see a couple different things. I wanted to start with some of the supplemental information that you guys may want to read in your free time. So the Kaiser Family Foundation put out a report, just really sharing where people's understanding of ambiguous regulatory environment around access to reproductive health care, including abortion and birth control really is. So I would encourage you to read that through just to have some understanding of the reality here in the United States. I did give you guys a final report on our AMI immunization. So we did, by and large, adult boosters related to Pfizer. So 318 of those, and we had just 21 minors, which is actually really good. We want those minors to be connected with their primary care providers and having those parents connect with the provider so that they can ask other questions in addition to not just their COVID shots. Gave you guys a handout on rule change to school immunizations and childcare immunizations. It is bringing Wisconsin more in line with a very long-standing ACIP recommendations on vaccination. So the short and sweet of it is that people that are younger than me really don't know what chickenpox look like. So to have the ability to attest to your child having had chickenpox when you never had chickenpox because you were likely vaccinated makes it really difficult. And so this, for new people entering school here in the state of Wisconsin, they need to have a provider verify that. And they can either do that through listening to the family and talking that through with them. They can do it titers potentially, just so that there is more quantitative data behind that assessment versus, my generation, we knew what that looked like because we all had it. But parents these days don't necessarily know because they don't have that firsthand lived experience. And then it changes the timeline for their tetanus, diphtheria, and pertussis so that it is more in line with the other shots that they get at 7th grade, so that we're not having parents inconvenienced for having to make one appointment and then make another one. So it really just gives parents a little bit more ability to make those appointments all at one time. And then finally, meningococcal vaccine. So meningitis kills people. It has a very high case fatality rate. Early in my career, I worked mass vaccination. We had 4 fatalities on a hockey team associated with meningitis. And so really happy to see that following up with, again, those ACIP recommendations to have, again, for new students, 7th grade, and new students at 12th grade, meningococcal vaccines. Parents can still have a personal exemption, religious exemption, or medical exemption to those vaccines. That has not changed. The reason I put it in your packet is because there is likely going to be a hearing from the legislature here in Wisconsin on March 6th. And there is a possibility that they may roll back part or some of that administrative rule. For your awareness. And then I did put in my normal update. I do want to share with you guys with the health department update. I'm likely going to drop both influenza and COVID from the updates moving forward. We're seeing just a real consistent level of COVID and our influenza rates. Is not saying that we won't go back up because sometimes there is a double peak in years, but we have really come down with influenza. So I will discontinue that in our regular update to you guys. I did want to highlight 2 outbreaks that are really important for you guys to know about. One is a significant increase in TSS, or toxic shock syndrome, related to adolescent girls and using super absorbency tampons. And so we've done some outreach in the community, some of our pantries have actually increased access to these products for their families that use them. And then all of our schools have or are working with us to increase access as well. So that is something that we're doing in real time because it can save lives. 4 out of the 5 cases were hospitalized in
Yeah.
Wisconsin. And then the Pseudomonas aeruginosa, the contaminated eye drops. And so I think that that's important for folks to know, when something is preservative free, there are these checks and balances to make sure that they are free from bacterial contamination. And this one made it through their quality control with some very significant issues. So I lift that up. And then also looking at our team. So you guys will hear that we have a new public health nurse that's starting with us, and we're really excited for that. Also, that we are starting that process to do some qualitative data and focus groups related to reproductive health. So 2 of our team members went to the University of Minnesota to learn more about how to run focus groups, and I'm really excited to see how that will work. We have a student intern that hopefully will start here pretty shortly, and then we will start those focus groups in March. We have done some outreach to our local grocery stores around WIC specifically. There is some confusion, and of course you'll hear more about this later. There is some confusion about impacts to WIC programs, and while food share is being impacted, food share and WIC are completely separate, and there is no impact to WIC at this time. And so we're hopeful that with that outreach to our grocery stores, that folks will know that WIC is an option to them that can help their food share dollars go further. Any questions on any of that?
Any questions for KT? All right, KT, go ahead.
Good deal. And so Supervisor Morehouse and or Assistant Corp Counsel, I wanted to just ask when the most appropriate time is to talk about carry forwards.
Do it now.
Okay. So I need to let you know that I did not get the public health carry forward in our agenda as an agenda item. You do see it in the omnibus, and you will see in the whole county carry forward request that the health department is requesting about $306,000 to carry forward from 22 to 23. The vast majority of that is for multi-year grants specific to COVID. But because there is not an agenda item, I need to ask for you guys' forgiveness, and then also ask for a special meeting specific to approving that before the executive committee, so that it can be included when it goes to exec, and then included when it goes to the county board.
Yes, and so what this board will need to do is respond to a request for a special Zoom meeting. I doubt that it would take much longer than 10 minutes. But we have to do that before the executive committee meeting on Wednesday, March 8th. I would propose next Thursday, which is the 2nd of March at 5 p.m. Would that work for people for a 10-minute at most meeting? I'm seeing Dr. Hall shake her head.
What?
Yes, Supervisor Hagan.
What time did you say?
I said 5.
I have a meeting that night.
Would another time work, Ms. Barker, or?
It's a very late night school meeting.
Okay. Could we try for, I love this, could we try for Wednesday, March 1st at that same time? Dr. Hall is affirming. Supervisor Steen, Ms. Barker, Supervisor Hagan, Supervisor Breslin, yes or no?
I'll be out of town, so I can do it in Zoom, but
It will be a Zoom meeting. It would
yeah.
be Zoom. Okay. So we're looking at Wednesday, March 1st at 5 p.m. and we will get we did draft the agenda this afternoon, and we will get a notice and the Zoom link out to you ASAP. Thank you, everybody. Thank you, KT. We're all good.
Wonderful. And so no questions on any of that. So we're going to move to finance. Because we don't have good projections on that first month, and we actually have to submit our agenda and our packets the day before the update is actually run. I do not have the 2023 first month financials for you, and so you do have a continuation of how we're buttoning up the 22.
Okay.
So that's what you have in front of you today.
Any questions on the 2022 financials? Supervisor Steen?
Yes, KT. Then am I to assume that that same situation happens monthly for you? So, okay, so then actually we'll be getting a month behind kind of.
That's correct.
Okay, thank you.
We've been sort of used to that with human services, I think,
Yes.
because
yes.
of the way things work. But yeah,
Right.
that is the case. Anything further? Is that it, KT?
Budget adjustment that is later in the agenda.
Yeah, exactly. All right. Well, thank you. And we will move on, and I will turn this over to Ms. Winter, who has an introduction for us.
Yes, thank you. First of all, I wanted to direct your attention to the report that I completed, and in your handout, I think the topic of the day is a lot of collaboration with others and grant writing. And in fact, I wanted to mention that Jessica Lindstrom, who is here with us today, the economic support manager, and I spoke with a gentleman from UW Stout today that is working on Dream Grant, which is a childcare grant, along with the Community Foundation and other partners to look at the childcare issue as well in the community. And so we've just really been spending a lot of energy in writing different grants and hoping, applying and hoping to get them. So more to come on that. So without further delay,
And may I ask a question on your report?
Sure.
You heard anything else on the rent issue with the transitional housing?
Mm-hmm. So, yes, we did hear, so a little background on that. In the report, it states that West Cap was not able to enter another lease with the landlords of the transitional housing due to their challenge with their stated challenge with finding renters in January. Yeah, in December, January, for the January time period, for that time frame. And so they said that the only way they would enter that lease would be that if we would pay the full amount of a year lease for the months that would remain up to the end of December. I did check with the Department of Administration, Decker, and they did agree to allow that as long as we have the funding in our budget to do that. We have identified that funding. I'm going to be meeting with West Cap and Stepping Stones to talk about, some shifts in that funding to make that happen. And so hopefully we'll be able to manage that issue, and we'll be able to keep the transitional housing through the end of 2023.
Great, thank you.
You're welcome. Yeah, any other questions on the report? Okay, I am going to introduce Jessica Lindstrom. She, again, is the economic support manager for our department, and she has been working really hard with all of the changes that are coming forward, and wants to share with you the information, tonight regarding that. So I'll hand it off to Jessica.
Thank you, Paula. I'm Jessica Lindstrom, and like Paula said, I'm the manager for economic support here in Dunn County. First and foremost, I just want to spread a little bit of joy. One of our clients, well, several clients tend to call the call center, and in our interviews or interactions with them, they like to tell us jokes or tell us funny stories or whatnot, and then staff in turn share it amongst ourselves and stuff. So we're spreading the joy. This latest riddle was, what do you get when you cross a snowman with a vampire? And that's frostbite, which is kind of fitting for today, but I'm here today to talk to you about the unwinding of the pandemic benefits and how that's going to affect those clients that are on food share or any healthcare benefits with us. The COVID public health emergency was officially renewed effective January 11th for an additional 90 days, but some Medicare and food provisions are no longer tied to that public health emergency. Food share, emergency allotments are ending with the February issuance. Most recent reliable data from DHS shows that in December of 2022, over $535,000 was issued to Dunn County food share recipients. And that's above and beyond their normal food share allotments. So that's a big chunk that they will be missing out of starting March going forward. DHS has shared the community, has started a very broad communication campaign, which began in January of this year. This does include news outlets, social media, banners on our Access website and on the My Access mobile accounts, messaging in the call center before the clients actually reach an agent. When they do call the call center, they're hearing that before they even talk to an agent. Agents are talking and informing all clients about the ending of the emergency allotments. If we have the client's cell phones or emails, they are getting text messages from DHS along with emails from them. Every client will also get a physical mailing in the mail, and then notices that are hanging in all our local agencies. As they come up to the front desk, there's a notice in the windows for them to see. Okay. The maximum allotment for regular food share has increased about 36%, and I think I put on there on the sheet 34%. That was an error on my part, but they have increased about 36% since 2020. The maximum allotment for a household of one is now $281 per month. In 2020, the maximum allotment was $194 for a household of one. So the maximum allotment size has increased, but the EA benefits are going away. Some of the things that are coming back with food share are some of our regular policies, which does include drug testing for clients that have been convicted of a drug felony within the last 5 years. That will resume as of June of 2023. Also, the work requirement for food share recipients is still postponed and has not yet come back. There's not a definite date on that one, on when the state will bring that back. Last rumor I heard, it was potentially 2024, the early part of 2024, but that's not defined completely yet. Any questions on the food share part?
Any questions for Ms. Lindstrom? Yes, Supervisor Hagan.
Yeah, I'm just trying to wrap my head around the meal numbers. So with the allotment of $281 a month, I just did quick math. To me, that sounds like it'd be about $9.30 a day or $3.12 a meal. Is that a way of looking at it, or am I off with that?
Go ahead,
Yeah.
Ms. Lindstrom.
Yep, that's one way of looking at it. Yep.
Okay, thank you.
Any additional questions for Ms. Lindstrom? Supervisor Steen.
Yes, Ms. Lindstrom, your mailing notice out to the people, has that went out yet? Or when is it going out?
Yep, that has started to go out already. They started
Okay.
sending those out in January.
Thank
There
you.
will be a select few clients that if they were eligible in for food share in January and February, but did not receive their emergency allotments in January or February, they will be getting their emergency allotments for those months in catch-up runs in March and April. So there will be some clients that still are getting their emergency allotments, but that was 4 months that they should have
Sure.
received prior.
Sure. Thank you, Jessica.
Madam Chair,
Yes,
could
please.
could you just speak to the fact of the maximum allotment? Because there are a number of individuals who are single households who do not receive that, correct?
Correct. So the food share calculation is based on 1, the household size, 2, the income for the person in that household or for the entire household, and expenses depending on what type of household you are. If you are part of the elderly, blind, or disabled community, then you may be eligible for extra expenses than a family that's not part of that population, such as if they have high medical expenses or whatever. If they turn in those, we can look at increasing their food share with that, as long as we have proof of that. Some of the eligible expenses for all households do include heat, utilities, air conditioning expenses due to high heating in the last few years, or high heat in the summer in the last few years. It does include your shelter costs, rent, household house payments. If you own your home, it does include homeowners insurance and taxes and stuff like that. So we do look at a large variety of expenses. It does not include vehicle expenses, health insurance, unless you're blind or disabled or elderly. But there's a whole calculation and a whole slew of items that we look at that determines that allotment size. So one person could be receiving the maximum allotment for a household of 1, whereas the next person isn't.
Does that answer your question, Chris?
Yes.
Okay. Supervisor Steen?
Yes, Jessica, I don't know if you can answer this or not, but it's my understanding that child support is considered part of their income. But what if they, the situation I'm talking about is they're supposed to get so much child support, but they don't get it, but it's still being counted as part of their income. Is that correct?
So how we handle child support is, yes, it is income that is counted, but we take, basically we have been instructed by the state to use like a 3-month average of what they've actually received. And that's how we prorate. If they are ordered to receive, let's say $500 a month for that child, but they're only receiving $50 a month, that $50 is what we count as income.
All right, thank you very much.
Yep.
Anything?
My
Yes,
audio or
Dr.
my
Hall.
video.
Thanks. So thank you so much for being with us. I have so many questions, but can you give me an idea of like maybe the average or the median amount of food share benefits that somebody's getting right now with the extra emergency allotment, and then kind of like the average or median that it's going to be? You're just trying to get a sense of kind of like that. I know there is no such thing as like average person, everybody is different and unique, but just maybe the size of the impact that people might be seeing, if there's a way to give a general idea.
Right off the top of my head, no, I can't give it, because there's such a diverse makeup of families that or households there. Right off the top of my head, no. And the most current stuff data that the state is giving us right now with the emergency allowance is still December's numbers, so they have not released the January numbers for us yet. So
Jess, if you took that, if you took a single individual though, the maximum allotment amount with the benefit minus and without it, do you know what that amount is?
So if a client, household of 1, is receiving the maximum food share allotment, their emergency assistance benefit would be $95. So the whole calculation with the emergency allotments is the family or the household receives at least $95 per month, or the maximum allotment, whichever is greater. So there may be families that are not yet receiving the full maximum allotment of food share. And they are, let's say, $87 short of the maximum allotment. So they get the $95 instead, because that's the greater amount. If somebody's $120 short of the maximum allotment, they're going to get the $120 to bring them up to the maximum allotment and not the $95 standard allotment.
Does that answer your many questions, Dr. Hall? I think the impacts
That's
of this
helpful,
are
right? So there's somebody who's maybe been getting 280-ish as a single person who now maybe once this adjustment is gone due to their circumstances might be getting 50.
Mhm.
Potentially.
Potentially.
Right? This would be a huge, huge change for somebody.
Mhm.
Thank you.
And especially as the cost of groceries goes up,
right.
whatever
Right.
money they do get is going to buy less.
Mhm.
Yeah, there will be significant impacts of this, I fear. Supervisor Hagan, do you have a question?
Sorry, yeah. Are you able to hear me?
Yeah,
Okay, great. I had to change audio because it faulted out again. Sorry. A quick follow-up question about child support. I know people who are paying child support. Is that calculated for them into the food share calculations at all, or is that?
Yep, that is an
into
eligible
consideration?
expense. And again, is what they're actually paying, not what they're court ordered to pay. So that is an eligible expense. They just have to make sure that they're reporting that to us to be eligible or to receive that expense.
Thank you.
any further questions? We may, with Paula's consent, ask you to come back in a couple of months and talk to us about some of these impacts when they're a bit better known, because this is a pretty big issue.
Yep.
So we would appreciate that, and thank you, Jessica.
Any other questions before I move on to the healthcare impacts?
Go ahead, please.
Okay. The Consolidated Appropriations Act decoupled healthcare coverage from the public health emergency. Even though the public health emergency continues, some of the COVID policies again are no longer being followed or will be allowed to expire. The healthcare emergency on our end, or the unwinding, I should say, on our end, does begin April 1st. What that means is any new applications for healthcare coming into us with a filing date of April 1 or after will be subject to regular ongoing eligibility policies. They will have to complete a full renewal in 12 months. They will have to provide any verifications that are requested by us. They have to follow the normal standard processes for filing an application. The first healthcare renewals will be due on June 2023, and they will be distributed over a 12-month period through May of 2024. The healthcare renewal dates were actually just determined this past weekend. The Great Rivers Consortium will have approximately 5,000 to 6,000 healthcare renewals per month until May of 2024. Letters will be mailed in March, informing the clients when the renewals will be, what month that they will fall on. Because we have gone 3 years with COVID that we have not done a renewal, and healthcare policy does state that they have to complete a full renewal every 12 months. That policy was suspended during COVID, so the state had to redistribute all the renewals. Along with that initial letter in March, the clients will start receiving their normal 45-day reminder letter. So they get a letter the month before their renewal is due, and they have until the end of their renewal month to complete the renewal. Cases will be continued to be tested under our COVID policies until they complete their renewal. So we will, in this transitionary time, we will have some cases that will be continued to be tested under COVID policies, and some cases that are being tested under the regular policies. It is anticipated that the healthcare premiums and substance needs questions will not be reinstated until 2024, but the clients currently are still responsible for for co-pays if applicable. Some households do have to pay co-pays, some households do not, depending on their income. Any questions on that?
Dr. Hall.
So I'm anticipating that with the change in food share that's happening in the next month or two, and then also then starting the month or two after that, or well, in April with the new enrollees, and then starting in June with people having to renew for the first time, an increased work burden for your department. And also my question would be, what your turnover has been over the last 3 years, and what percentage of your staff are ready to do renewals for health insurance coverage, and do you need additional support, training time, those types of things, because it seems like a heavy lift is coming your department's way just in the next 3-4 months are going to be pretty tough.
Yes, and all of the supervisors with the Great Rivers Consortium, we have been identifying those areas. The state has hired ES workers that are no longer part of the ES world due to retirement or whatnot, as long as they left within the last 6 months. They've hired a team to help the different consortiums in the state where needed. They will not help with any call center load, but they are willing to help with some of our paperwork type work. As of right now, we are watching the staff's workload with an eagle eye. The state has opened up options for completing or for having overtime for all of the economic support. Right now, they are only allowing us to have overtime for food share, which with the workload that we have, the Great Rivers does not feel that we need that overtime at this time. Once April comes around, and especially June, when we start doing the renewals, they are opening up overtime to healthcare for us to utilize for healthcare as well. We have had, what, 6, Paula, in our department, I mean, leave with retirements and all of that. So we have a brand new set of staff in our team. Consortium wide, they have hired many spots throughout COVID. So we do have several staff that have never applied the regular policies. And even though they learned it in training, they've never applied that. So they are having to relearn it again. The state has required that every staff member takes several refresher trainings to bring us back up to speed with the correct policies and stuff. There were some policies that did change during COVID that we never applied until as we're starting to unwind. So yeah, the GRC supervisors are very much keeping an eye on the workload and opening it up where we need to, if we need to. But at this time, we don't feel that we are at a place that needs it. Staff are keeping up. I think the staff are, on one hand, they are able to kind of breathe a sigh of relief because we know now when it's going to start instead of continuously trying to, play that ball game. So.
Any other questions for Ms. Lindstrom?
Can I add one additional thing or make one?
Of course, Chris, please.
So because we talked about this when I was still in the role of the DHS director, I just want to reiterate that beginning back in somewhere around March of 2020, in the world of Medicaid coverage, essentially, if you came onto the program, you were not means tested between March of 2020 and now. So people have been receiving healthcare coverage for the last almost 3 years, essentially, without any means testing. Now, some of those people's life circumstances have changed. But some people also have well, many people's life circumstances will have changed. Some people will be in the middle of a transition of, you know, of significant proportions, because that's how life works. So let's say that you're receiving cancer treatments, or you're in the middle of a series of mental health treatments, or you are, you know, you're at the nursing home. And you are having your coverage. And then now when we begin to look at whether you're truly remain financially eligible, you may lose your Medicaid coverage after not having had that checked for the last 3 years.
Sure.
Whether that was the right process or not, you know, is debatable, but the reality of it is that real people will have become accustomed, similarly to the food share benefits, have become accustomed to, all of us would struggle in losing, you know, $100 or more a month in our food benefits. And people will struggle with their health care as well.
Yeah. All right. Anything further? Thank you very much, Ms. Lindstrom. Very helpful. And as I say, we'll ask you back if you're willing. Paula, it's back to you, I think.
All right. So the next document I would point you to is the 2023 financials for our department. And as you've heard from the last two departments, it's really challenging to know where you are in 2023 because we are always about 3 months behind in our projected revenue and expenses. And so what you see here tonight of $545,683 actual is really challenging to quantify as far as what that really looks like, and especially the projected as well. In the next 3 months, we will be able to balance that out a little bit more by, you know, getting in that rhythm and getting some of our revenues in once we bill Medicaid and all of the other providers that we bill. So, yeah, not a lot to look at tonight with that. I do want to share because Jerry from Finance has been working hard on our 2022 document, and that was just got done this afternoon. So I apologize that didn't get out in the packets.
But it did come out this afternoon.
It did. Yep.
Cassie
So
sent it.
yep, it was sent this afternoon, but I apologize it wasn't earlier in the regular packet. So I wanted to share that my screen with you on that. And again, we run lots of periods with this, so this is not a complete picture for us by any means, but at this point, we are projected to end 2022 at $316,205. And again, like last month I talked about, we had the situation with one of the errors with the SAP system and picking that up from the Excel file that created a discrepancy in what we had been reporting. And in addition, this month, we found out that the last period of salary and benefits had not been projected into the document that you had seen previously as well. So that got added on to the other error. And so it just ended up to be a weird year where those pay periods came out strange compared to normal. And so when we looked at that, that wasn't done either. So this number is significantly lower than what we thought in the last, you know, how many months, but it is still, we're still above, you know, we're still, you know, going to be above 316,000 about approximately in there. Again, we will have further information as we continue, but that looks like, you know, would be close to what we should be predicting there for that.
It is not as much as we were anticipating earlier in the year, but it is to the good.
It is to the good. And so I'm joyful about that. I said, I don't want to come in my first year and not be to the good. That would be awful. So I'm grateful for that. So more to come on it, but that's where we sit today. Any questions for me?
Any questions for Ms. Winter? Supervisor Steen.
Yes, I could direct this to Chris or Paula or both. Relating to Chris's email about the big change that's going to be happening when we reevaluate where we want to be on our setup. Is it fair for me to say that the most complicated department working with these systems would be the human service?
I guess I'd let Chris, because I'm not aware of other departments, but I do, before I pass that on to Chris, I do want to say that our citizen board members may not be aware of that. And the news that Supervisor Steen is talking about is that the SAP system, financial system that we're currently using is having some major changes that would have us look at would we continue using that system, but having to have a full change, even continuing with SAP or moving to a different system. So in the next year, we're going to be researching that and bringing recommendations forward. But even if we continue with SAP, it would be a whole change in systems because of what they're doing. And so Chris, I don't know if you wanted to share more about that and the question.
So I think that it is true. The Human Services Department poses a special set of complications to the utilization of really any financial system. And here is why. Ideally, you would, if I work in, I'm going to just be a real simple example. If I work in for a local, say, grocery distribution center, I get assigned to an area. I probably work within that area and all of my costs get billed to that area. When we have staff who work between multiple programs and switch many times throughout the day and so many different grant funding streams, the only way to have that work truly in real time and know exactly where our money is going in the moment would be for people to do 100% changing out of their time all day long. So if I was working on this for 5 minutes, I would do this, and then I would switch in a time recording system to working on this. And we do not have that capability. It also would be, we would potentially utilize as much time tracking our time as we were benefiting from that. So what happens as a result of that is that we have to set our staff up at the beginning of the year where we think that they will mostly spend their time. Then based on where they really spend their time, we go back and adjust the system. So there is always that delay. Similarly, as Paula indicated, because our revenues tend to lag. So if you think about, I've said this sort of many times, you think about doing business in January and receiving invoices for the business that we did in January in February, and then paying them. We really don't have a clear picture of January's expenses until the end of February when all of those invoices are paid. Similarly, if we do business in January, deliver a service, we create an invoice for that service in February and send it off, depending on the timeliness of the payer, an insurance company, Medicaid, whoever. We may not see payment for that until March. So there's those delays that looking at a simply point in time is difficult. So no doubt human services is complicated. The other department that has incredible complications is the highway department.
Supervisor Steen, please.
Yeah, and the only reason that I raise this concern is that our last go around with SAP was very disruptive and caused a lot of consternation in management and in the people that were doing the work. I'm just hopeful, and I think you're aware of that, of course, and you want to minimize the negative impact that may. If we can ease that in any way and make it easier for our workers, that's what I'm driving at.
Sure. It's probably not too strongly stated to say we're not going to do that again.
I just remember coming on this board and I think it was every month we were talking about SAP and the frustration behind it. And, you know, I don't hear as much of that now, but I remember when I first started, it was like, oh my goodness, why did we even do this?
That question has been asked more than once. I'm pretty pleased with the process that our new county manager has outlined, and I assume us senior staff are as well. So let's hope it works well. Supervisor Steen.
Yeah, and I just want to have Paula and Chris and you, Diane, communicate my appreciation of the hard work that went into when we got our head around the SAP. It was not easy, and the employees worked very hard. I'm very appreciative.
Oh, yeah. Yeah, absolutely. Thanks are definitely in order. Paula, anything else?
No, I do not have anything.
All right. We have a number of action items moving along. First is the review of our January DHS vouchers paid. This is our checkbook. If you remember, this is what we pay out in month. The total is $523,513.12, $523,000. I need a motion to note review of the January DHS vouchers pay. Ms. Barker moves. Is there a second? Dr. Hall seconds. All in favor, say aye.
Aye.
Anyone
Aye.
opposed? DHS vouchers are noted. We have a carry forward request from the Dunn County Veteran Service Office in the amount of $971.84. I don't know if Greg is still with us.
I'm still here.
Do you want to speak to this briefly?
Yeah, it's donated. Let me specifically look at the.
It's relief.
It is for. This year's carry forward is for veteran relief donation of $971.84, and we're requesting that it be carried forward so that we can execute on the donor's request to spend that for soldiers and sailors relief.
These carry forwards for the newer members are this is pretty routine. Again, it's like a budget that it is a budget adjustment to move some money into the next fiscal year. So I need a motion on this to approve the carry forward request. Supervisor Steen and Ms. moves, and she can talk, and Ms. Barker seconds. Any further discussion? All in favor, please say aye.
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 Any
Aye.
opposed? The carry forward request for Veterans Office is approved, and a carry forward request, same situation, from Human Services. Paula, do you want to speak to this briefly?
Sure, this is in the large packet of the county resolution, and it's page 4 of the document. And we have an ADRC donations and contributions. So one was for a training that we weren't able to put on during COVID, and we're hoping to do that this next year. So the money was specific to that. The other one was a donation by a private citizen that they wanted to go to the ADRC, and we're looking at a specific project for that one. So that would be the combined $3,020. And then the second one is for the counseling and therapeutic services, $8,000 carryover expense and revenue. And that is to set up our forensic interview room for children that are alleged to be abused or neglected. We were able to get the video equipment in those pieces, but we weren't able to get the furniture yet with the delay of things with COVID. And so we would like to carry that money over to get it equipped so we can do that. Any questions?
All right. We do have a motion and a second. So all in favor?
Aye.
Aye.
Any opposed? All right, the carry forward request for Human Services is approved. And then we have some items to move on to the county board. 2 budget adjustments, one for Human Services, and a second, which we will need a second motion for the Department of Public Health. Public Health, I guess, is up first. KT, do you want to speak to this?
Sure. So what you guys have in front of you in the packet are 4, I would say, small grants, but wanted to get them in front of you so that we could use them. One is a scholarship where they wrote for and received a NEHA scholarship to attend some food safety training using the national framework NEARS. And then another one was a small grant to offset some of the work that we're doing to provide case management for Ukrainian refugees. We've had a couple households sponsor Ukrainian refugees, and about 20% of the current folks that have come through, because Ukraine is an endemic for TB. I think I said that right.
You did.
And so 20% of the folks that have come through have been LTBI or latent TB positive, meaning that we need to help support them get to the care that they need. And it takes our nurses just a little bit extra. And so there is, like I said, a small grant to offset some of that cost. And then another minimally competitive grant, a competitive grant for our health educator to do some community-based Narcan training. That's what you have in front of you today.
I'll need a motion to approve the budget adjustment for the Department of Public Health. The amount is $44,500. Supervisor Steen, is that a motion? Is there a second? Dr. Hall seconds. Any discussion? Questions, comments? All right, all in favor, you say aye.
Aye.
Any opposed? The budget adjustment for public health will move forward to the county board and public health. Public health is in front of you. I got too many pieces of paper in front of me. Paula, would you like to speak to this one?
I would, but prior to doing that, I would like to ask for clarification of who made the motion and seconded for the human services carryover, because Cassie and I did not get that. Did not see who did that.
I forgot.
Okay, that's
I think I did.
I think Gary probably did.
okay.
Bonnie, did you second? Oh dear, we're in trouble.
I'll second it. Don't worry. Put me down.
Okay. Okay, thank
All
you.
right.
It just went
All
really
right.
quick and neither one of us got it. So the request for budget adjustment tonight is really a look at all of the grants that we received in human services in 2020. And many times we put in the budget what we think we're going to get, and then it's something else. So what you're seeing is what we actually received for grants in 2020 to clean up those adjusted amounts for what was actual.
All right. We do have a motion on this, don't we?
No,
If we
we
don't-
don't.
No, we didn't. No, we don't. Okay. God, no wonder I can't remember because we don't have one. All right. Supervisor Steen moves. Is
I'll
there a
second.
second? Dr. Hall seconds. Any further discussion? If not, all in favor, say aye.
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 Any opposed? All right. The budget adjustment for human services is approved. And then we need to act, I guess, separately on these carry forwards, yeah? Am I right about that, Ms. Fagan or County Manager Corpola?
Are they listed separately? Sorry.
They
I-
are, yes, they are indeed listed separately.
Yes, so you
Alright.
would, so you have the entire roll-up of all of the carry forwards that will come forward to the county
Yes, we
board,
do.
and you'll just be taking action on those related to human services.
Correct. All right,
And
so
Greg's.
go ahead, please.
Oh, you did Greg's.
Well, I mean, we've approved the carry forwards and now we need to approve the resolution. That's what I guess what I was asking.
Oh, no. I'm sorry, I closed my computer. So I can't see what you're saying. If the action that needs to be taken is that you've approved the request for the carry forwards.
And we did.
Resolution just is the format in which that is going forward.
So do I need I should have asked you this question before I'm taking up people's time to be stupid. Do we need a second set of votes then?
No,
No.
if you had it, if it was agended for action for the approval of the carry forwards, that was satisfied and you don't need to do it again.
All right, that is correct. So that I believe that we have concluded our business. So just a reminder, March 1st at 5 p.m. via Zoom, announcement to follow shortly, to look over the carry forward request for public health. And then again, our next regularly scheduled meeting is March 23rd. Yes, Supervisor Steen.
I'd like to thank Paula and Diane for having the Zoom meeting today. I don't know what you folks said, but we had 13 inches over here in Colfax, and I'm happy to be inside. So thank you much, and everybody be safe going home now.
Yeah, everybody be safe. I didn't get plowed out until late too, and it just doesn't, you know, people have to drive a long ways, and it just didn't seem sensible.
I was watching the deer eat out of our bird feeder, and they were plowing up to their bellies in snow now where it had been gone.
Yeah,
And
yeah.
now they are walking through this again. And I'm just like, oh my goodness.
I know.
Yeah.
Well, keep our fingers crossed. It's almost over. Any announcements from anyone? Ms. Becker, thank you for joining us. And the materials that we were discussing tonight, you will find on the Dunn County Public Calendar. Just look at that on at the Dunn County site, and you'll have all of those documents in front of you. Dr. Hall, did you have an announcement or a comment?
Yes, just that SpongeBob the musical is being put on by the high school, but opening night got postponed from Friday to Saturday. So get the word out if you're planning to go tomorrow night.
And there would be a certain handsome young man that you know quite well who would be in SpongeBob. Is that Bob?
And
Is that
he's
correct?
tap dancing.
Tap dancing.
He's tap dancing to a tap number that I choreographed.
Alex, this is awesome. All right.
It
We'll
is
be
really
there.
fun. So it's this weekend and next weekend, pretty steep ticket price of $4. So
We'll make it. All right, everybody, thank you very much for joining us in this kind of interesting format that we'll get used to, or maybe we won't. Thanks, everybody. We are officially adjourned.
Bye-bye.
Bye-bye.